when to suspect rheumatic disease in your patients. Because as a rheumatologist, I'm very unlikely to be the first person that sees the patient about their pain or their symptoms. So it's important for, I think, anyone working in healthcare, especially in a primary care setting, to have a bit of a radar up about autoimmune disease when they're seeing someone in pain. So what I find is very helpful is to try to characterize the pain a little bit better. So we learn this in med school about how to kind of compartmentalize to come up with a story that then we can make a differential diagnosis. And so what I find is helpful is to establish the pattern of the pain. So is it generalized, widespread pain, it hurts everywhere? Or is it in certain areas? And could that be in the joints, in the muscles, or maybe a particular joint? Could it be in the bones or in the lower back? And if it is in the lower back, what is that character of the pain? Is it more an inflammatory type of pain or more mechanical? And we'll talk a bit more about that. Is there pain in the muscles? And then are there systemic symptoms that don't really make sense as far as why this person is coming in? So also going back to a bit about how we approach pain in med school, I think important to be able to tell, is the pain in the joint or outside of the joint? And as you might remember, in the joint, we think that while any direction the joint moves is going to hurt. So pain in all or most range of motion. And it's going to hurt whether the patient moves or whether you move the patient. So active and passive range of motion. They may have swelling or tenderness over the joint line. Compare that to like a periarticular pain, say a rotator cuff, where they're going to have pain in certain range of motion, or maybe only when the patient moves, but when you move the joint, they feel okay. Neurogenic pain often comes out in the history, maybe in the exam as well, and then referred pain or other types. And I think this is one of the most important slides for, does my patient have a rheumatic disease or should I be suspicious, is if you can tell whether the pain, especially if it's joint pain or back pain, is inflammatory versus non-inflammatory. And we classically think of inflammatory pain as being worse with rest, getting better with activity, and a lot of stiffness, so more than an hour of stiffness. Whereas non-inflammatory pain, it hurts more when they move it. They feel better when they're resting, or at least that alleviates the pain. And they might be stiff, but it's not usually more than 30 minutes.